Hi everyone, welcome to our presentation on articulation disorders in children. We're students from the University of Scranton's Communication Sciences and Disorders undergrad program, and today we'll be walking you through what articulation disorders are, how they're identified, what causes them, and how speech therapy can help children develop clearer, more confident speech. Let's get started. Okay, so an articulation disorder is when someone has trouble physically producing certain speech sounds. So it's not about understanding language or knowing what to say, it's about how the sounds come out. So, for example, a child might know they want to say cat, but it comes out as tat or k because their mouth, tongue, and lips aren't quite coordinating the right way. Yet, it's a motor-based problem, not a language issue, so this can make their speech harder to understand, which can be frustrating for both the child and their listeners.
There are four main types of errors we see with articulation. First is substitutions, where one sound is swapped for another, like saying wabbit instead of rabbit. Then we have omissions, where a sound is left out entirely, like ka instead of cat. Distortions can happen when a sound is made incorrectly, but it still sort of sounds like the target, like a lisp on an S sound. And finally, there are additions where extra sounds are added, like saying bahaloo instead of blue. These patterns can show up consistently or in different ways depending on what the word and how hard it is to say. There isn't just one cause of articulation disorders. Sometimes it's due to a structural issue like a cleft palate or something like a tongue tie, where the tongue's movement is restricted. In other cases, it might be related to hearing loss. If a child can't hear certain sounds clearly, it's harder for them to learn how to say them. We also see articulation challenges in kids with neurological conditions, such as cerebral palsy or apraxia of speech, where brain-muscle coordination is impacted. But in many situations, there's no clear physical reason, and we call that a functional articulation disorder.
To figure out if a child has an articulation disorder, a speech-language pathologist, also known as an SLP, will complete a thorough evaluation. This might include standardized articulation tests that assess how well the child produces certain sounds in different word positions. They also listen to the child in more natural settings, such as conversations or storytelling. An oral mechanism exam is done to check the structure and movement of the mouth and tongue. There is also something called stimulability testing, where the therapist gives cues to see if the child can produce a sound when given help. This gives a big picture view of where the child is and what kind of support they will need. Speech therapy for articulation is very hands-on and interactive. It's often done one-on-one, but sometimes it can be done in a small group. The SLP focuses on helping the child learn how to make the sound correctly using techniques such as visual modeling, gestures, and tactile cues, and sometimes even mirrors so the child can see how their mouth should move. And of course, therapy is kept fun and motivating by using games, cards, and playful activities to help kids engaged while participating. Repetition is key. The more the child practices correctly, the more natural it will become.
Therapy follows a specific hierarchy. It starts with the child learning to produce the target sound in isolation, just saying the sound by itself like s. Then they'll try it in syllables like sa or so, and eventually in words like sun. After that, they'll work on putting the sound into phrases, sentences, and finally into conversation. The goal is to get to the point where the child uses the correct sound naturally, even when they're just talking with friends or family without thinking about it. Speech therapy doesn't stop when the session ends. Home practice is a big part of helping a child make real progress. When families do short practice sessions during the week, maybe 5 to 10 minutes a day, it helps the child strengthen what they learned in therapy and use it more consistently. It also helps kids feel like their parents and caregivers are part of the process, which builds confidence and keeps them feeling motivated.
The earlier we address an articulation disorder, the better. Early intervention helps prevent academic struggles that can happen when a child's speech is unclear. It also helps with social development. Kids who struggle to communicate can become withdrawn or frustrated if they're not understood. At the same time, it's important to know that some speech errors are totally normal at certain ages. For example, for a 3-year-old to say wabbit instead of rabbit. But if those errors persist past the age they're expected to go away, that's when we look at therapy. SLPs use developmental norms to figure out when a child should be producing certain sounds. For example, the p and b sounds are usually mastered at age 3, while sounds like r and th might not be expected until the age of 6 or 7. We also look at how intelligible the child is. basically how much of their speech is understandable to strangers. If a 4-year-old is hard to understand most of the time, that's a red flag and that the intervention may be needed. Articulation disorders are common and very treatable. With early support from a speech-language pathologist and consistent practice, both in and out of therapy, kids can make huge improvements in their speech. It's all about giving them the tools and support they need to be understood and feel confident when they're speaking. Whether you're a parent, teacher, or future SLP like us, understanding how articulation works is the first step in supporting these kids. Thanks so much for listening. We hope this gave you a helpful overview of articulation disorders and what speech therapy can look like. Every child deserves to be heard clearly, and with the right support, they absolutely can be.